Hi, my name is Kari Smith. I'm a native Texan. I received my undergraduate degree from the University of Texas at Austin. I then went to McGovern Medical School at UT Houston Health Science Center, where I received my MD. I then did my general surgery residency at UT Health San Antonio. Currently, I'm a board-certified general surgeon, and I've been in practice for 7 years. Since I was a little girl, I always wanted to be a doctor. I think like a lot of people who go into medicine, we all go into it because we love science, we want to help people, we have an interest in learning about the human body. But for me, more specifically, when it comes to surgery, my interest in surgery came from my desire to want to fix things. I like to see a problem, do something about it, fix it, and then see the results of what I have done to help somebody. My passion for what I do is driven by my patients. I know that having surgery can be a very scary moment for people, and being able to help guide someone through that and see them thrive and do what they love after surgery is very rewarding to me, and ultimately at the end of the day, that's what I love to see. My philosophy when it comes to caring for my patients is, in my opinion, overall pretty simple. I think of my patient as if they were my spouse or my mom or my dad or my sister or my best friend. If what I'm offering my patient is what I would be offering someone I care about, then I know that what I'm doing for them is probably the right thing. I treat patients that are adults, ages 18 and over, of both genders. The most common diseases that I treat are benign gallbladder disease, or otherwise known as biliary colic, hernias, small soft tissue masses that are benign, and appendicitis. I perform surgery that is both elective in nature and emergency surgeries. When it comes to both my elective and my emergency surgeries, the vast majority of the way that I do these operations is in a minimally invasive or robotic fashion. I received special training in my residency program to use the robotic surgery platform or a minimally invasive technique. In my opinion and in my practice, I've seen this be a tremendous help for both the patient and for myself as the surgeon. My patients tend to have much quicker recovery times, and the majority of my elective patients go home the same day that they have surgery. Additionally, from a surgeon's standpoint, the dexterity that we're able to have using the robotic platform helps us perform more complex surgeries as well as more difficult and challenging surgeries, and continue to use a minimally invasive approach rather than have to resort to an open approach, which would lead to a larger incision and a longer recovery time for the patient. As a physician, I want people to know that I love what I do, but I also want to empower them to learn about their disease process so that we can work together to do what's best for them, because every patient is different and every approach should be tailored to each individual patient. I want patients to be their own advocates and for me to be there with them through the process. I've been serving the community of San Antonio and its surrounding areas for the last 7 years, and I look forward to continuing to do that with Stat Surgical and the Baptist Medical Network.